When I was working in the Texas Medical Center for many years, I spent a lot of time with 12 different healthcare systems. What I saw was that seniors were really overburdened with navigating the really complicated healthcare system we have. And so I saw this manifest in things like having to have a call center for staffed with nurses to be able to manage the calls from seniors as they're trying to figure their way to get the care they need. And I saw this manifest in poor outcomes, patients visiting the ER for unavoidable reasons, patients being hospitalized because complications because they waited too long. And so it just seemed like a necessity to be able to make healthcare simpler. So that is what was broken in healthcare that I saw and compelled me to launch this company out of the Texas Medical Center, spin it out with their support and their funding afterwards. And that was really how Lena was born. My name's Alex Harb. I am the founder and CEO of Lena. We launched the company out of the Texas Medical Center with their funding in 2019 and launched our first product about a year and a half ago. We're all born, my whole family's from Bolivia. My dad was studying medicine in Brazil, and during his residency, when I was born during that time, after he finished, we all went back to Bolivia. So it was, I guess, just timing. I've been in the US for 20 years, 10 years in Ohio, and then another 15 now in Texas. It gave me the perspective of, one, how people immigrate and how resources are achieved as you immigrate. We were a low-income immigrant family as well. But it also gave me a perspective because my whole family was entrepreneurial. That's what you do in South America and a developing country is you find ways to make ends meet. And so that was always in my veins, I believe. And so that was naturally why I became a founder, a startup founder. After working in the Texas Medical Center for many years, it just made sense to try and make something happen that's new, that's innovative. I was born to a really close-knit family where the culture in Bolivia was to take care of the grandparents as you grew up. And so it's always been in the back of my mind as I see elderly patients going home alone or elderly patients having to call on their own and figure things out. To me, it hit home. And so that for me was, I needed to see and create a new vision for healthcare and for the experience of the aging population. And so that was always a big emotional reason, a personal reason why I want to transform the way that patients experience aging and independence as they get older. Lena is a virtual assistant for seniors to help them navigate the complicated health system. They can text their virtual assistant to be able to set an appointment, find referrals to new doctors, ask questions about coverage, find transportation, all the things that they would be calling the call center, now they can just simply text their virtual assistant to get that thing done and get a concierge experience so that they get the support that they need. Lena is a combination, a hybrid model of conversational AI with a human always looped in. And we found this to be critical to provide a thorough end-to-end experience for seniors. Since we're trying to improve the outcomes of seniors and ensure that they engage and get the support they need, it's really important to make sure that technology doesn't introduce friction. So our technology is really built to handle any navigations as seniors reach out and be able to escalate it to the human as early as possible so that it really doesn't introduce a frictional experience and patients engage and continue to get the support they need to navigate their care and also avoid having to call the call center. One of our success stories that we always think about is the patient, one of the senior elderly patients, 74, just left her physician's office and he told her that she needs to see a neurologist. He gave her the name, put the order in, and told her to schedule an appointment. She went home and she forgot the papers, didn't remember the name of the physician, but she was able to text her Lena assistant and ask about that referral. And within 10 minutes, they handled it. So just the initial text is all that the Lena assistant needs to be able to then provide the referral to the patient, schedule the appointment, and set her up for reminders that the patient is really all set to be able to schedule that appointment with a physician. Really, we've seen a lot of traction with health systems, ACOs, and payers that are really feeling the pain point of staffing up nurses to these call centers. And so this is a really, we've seen a lot of traction with these large enterprise health systems like Houston Methodist ACO, Froedtert Medical College of Wisconsin, and Wake Forest Baptist Health in North Carolina, who are also trying to grow their population, but are having a hard time staffing up this call center. So they've provided those patients, those seniors, with a Lena assistant to be able to navigate their care and be able to augment their existing nursing lines. With our first customer, Houston Methodist, we've been live for 1.5 years, and we did a year-long study to look at the impacts of Lena compared to a baseline group, a control group. And what we learned is that this really does improve outcomes. First of all, patients that utilized Lena had lower ER visits, lower hospitalizations, and lower 30-day hospital readmissions. And the total average savings over this 1-year period per patient per year was $7,147, which is a big impact to the savings for this ACO that captures that as revenue. More so, we measured that Lena offset 19% of call center volume to those nurses so that they could practice at the top of their license. So we work ideally with providers and payers that are managing populations of Medicare patients, seniors, and trying to achieve lower costs of care in a value-based care model. And so these are ACOs, provider-sponsored health plans, and just general Medicare Advantage payers. We're excited because we have grown the team, we've doubled in size, and we have a lot of interest in being able to provide Lena to more patients and being able to measure more and more of these outcomes of how providing concierge and simpler navigation experience for this patient population can really improve outcomes, improve satisfaction, and generally improve the bottom line of these organizations that are trying to all make patients better and live healthier, more independently. So we found that up to 80% of all navigations that seniors need are automatable. So we are building our conversational AI to be able to handle end-to-end each patient need. So whether if it's fully automating the appointment scheduling for patients, the referral process, answering questions about coverage and costs, that is what Lena is doing. And so we see a world where patients can reach out and get an immediate response and scale up care coordination automation, which is something that is lagging behind in healthcare. And we think Lena is at the forefront of making that happen. Sorry, let me restart on that.
Sure.
So, Lena is...
Where